Let's talk about diastasis recti. So what is diastasis recti? Now this is when the abdominal muscles that run down the middle of your belly separate, and this can be very common during pregnancy. More than 1 in 3 women can experience this. Now the amount of separation of the muscles can vary. For some it will be the entire way down, and for others it might just be the midline that weakens where the two muscles meet. What are the causes? Well, commonly the pressure inside the abdomen obviously rises during pregnancy, and this can put more pressure on the muscles to then separate and make space for the babies. This is one of the common causes. Obviously, as you're carrying a baby and you're growing, there's also poor alignment normally, which can lead to more pressure on the muscles, again leading to the muscle separation being slightly worse. And there are also some exercises that can make diastasis recti worse. Things like sit-ups can actually make it worse. If you're doing the wrong exercises postpartum, that can also increase the pressure on the muscles and cause further separation rather than obviously bring them together. So how do you know you've got it? Well, sometimes you might be able to see it, so see a separation there in the midline, and it might be obvious. For other people, there might be other symptoms, things like, for example, back pain can be quite common. You might notice that your mummy tummy or the pouch in the center of the stomach is not quite disappearing, and there may also be pelvic floor dysfunction, so issues with the function of your pelvic floor muscles. How do you know if you've got diastasis recti? Well, there's a simple test you can do at home. Just look at the infographic below, which will explain how to do it. But essentially, you're going to lie down flat, knees bent, and you're going to basically lift your head off the bed, and then you can use your fingers to sort of press into the muscle, and you should be able to feel a divot there or a gap, which will tell you if you've got diastasis recti and the muscle separation or not. Normally 1 to 2 finger sort of gap is normal, and 3+ is normally where there's a bit more of a problem. For some people, you may go to your postpartum appointment, and at that point you're raising concerns about back pain, or not feeling that your core is quite back to where it should be, or pelvic floor dysfunction. Your GP can also check for you to see if you've got diastasis recti. So why is it a problem? Well, you normally will find that if you've got a big enough gap and it's not coming back together by 8 weeks, that you need to do some exercises or do some self-help that's going to help bring those muscles together. If you don't do that, what you might notice is that there's core weakness there's pelvic floor dysfunctions, you might have pain, you might have fecal incontinence, urinary incontinence, and just not the strength that you had pre-baby. 60% of women who have diastasis recti will also have pelvic floor dysfunction, so it's important to make that association and to ensure that you're getting the right diagnosis when you're trying to find out what the cause of everything is. So why does it matter? Well, if you've got a 3-finger gap or a larger gap and it hasn't come back together by sort of 8 weeks postpartum, you may need to have some exercises or some self-help that's going to really bring that together and give you some more strength in your core. Because if you've got diastasis recti, you'll notice some core muscle weakness, back pain, and for 60% of women who have diastasis recti, you also have pelvic floor dysfunction. So these are things like weak pelvic floors, you might have urinary incontinence, issues with obviously passing stool as well, or fecal incontinence. So it can really have an impact on your life. So how can we treat diastasis recti? Now, as a woman who actually suffered from diastasis recti after my first birth, I turned to MUTU, and this is a system which kind of helps with pelvic floor and postpartum, and they have an exercise program which is also used by NHS professionals for patients as well, which really helps with aligning the body, aligning the back, getting that core back together again and strengthening it. Nutrition, eating the right way after having a baby, and also your breathing can really help those abdominal muscles as well. So that's not to be underestimated. So how can we treat diastasis recti? Well, I think it's really important to think about those muscles that need to be strengthened. So that's your core muscles. So you can start with gentle exercises postpartum and slowly start to build on those to give yourself more strengthening of the central muscles of the tummy, but also of the pelvic floor. And so the MUTU system, which is what I used postpartum when I had diastasis recti, really helps to bring that together and to gently ease you into the right exercises. It also guides you on the exercises that you shouldn't be doing, so things like crunches and sit-ups, which can actually make the diastasis recti worse. Alignment is also important, so standing and sitting in a way that you're reducing intra-abdominal pressure and not putting more pressure onto those muscles is important. And again, the MUTU system really helps with an exercise program that can guide you to do that. And then it's also important to think about nutrition, so things that are going to help the collagen, the connective tissues around the tummy in your diet. So that's really important. And again, breathing exercises that are going to help to engage the core and the abdominal muscles and to strengthen those muscles again so that the muscles can repair and come back together. If you're looking for ways in which you can obviously manage your diastasis recti, there's lots of resources available on the NHS website as well. But for me personally, the MUTU system really worked because it tailors the exercise program and gives you lots of information around that. And for me, it really helped to bring my muscles together and help my core, help my pelvic floors, and also help my back pain as well. So I hope you found that video helpful. If you have any questions around diastasis recti, do pop in the comments section below, and any other topics you'd like to hear about, do let us know in the comments as well. Have a great day.